Hi everyone, my name is Shaylee Brown. I'm a registered nurse. I currently work as a medical aesthetics nurse in Ottawa, Ontario. I own and operate my own business providing non-surgical cosmetic procedures to clients in the community. I have decided to choose the 5 areas model because it is applicable to my practice, specifically in the screening for body dysmorphic disorder. So, cognitive behavioral therapy. CBT is a common and effective treatment that we see used with patients who have body dysmorphic disorder. The fundamentals of CBT, or cognitive behavioral therapy, suggest that what people think affect how they feel emotionally and physically, and essentially it alters their actions and behaviors. Cognitive behavioral therapy can be divided into 2 primary areas of consideration, that being thinking, so cognition, and behavior. These are essentially the building blocks of CBT assessment and intervention. The C component of CBT is unhelpful thinking styles, and the B component of CBT is altered behavior. For conditions such as body dysmorphic disorder, there is often an association with symptoms or diagnoses of depression and or anxiety. Essentially, these characteristic changes occur in thinking and behavior. In these circumstances, it is not uncommon for thinking to become extreme and unhelpful, and individuals may focus or fixate on themes that include viewing themselves as worthless, incompetent, as failures, as bad, or vulnerable. This type of diagnosis can also demonstrate as altered behaviors, such as reduced or avoided activity and partaking in unhelpful behaviors and activities. These activities can range from anything like excessive drinking to self-harm, reassurance seeking. Ultimately, in my practice, what I see the most are individuals seeking quick and easy non-surgical cosmetic treatments. Unfortunately, what the research supports is that the chase for perfection ultimately ends up worsening the problem. While thinking and emotional feelings are often important aspects of the human experience, especially during times of anxiety and depression, it is also important to understand the influence that other factors can have on the individual's experience. The 5 areas model offers a clear guideline to help practitioners and patients better understand the effect that different aspects can have on their well-being. The model considers 5 main components, which are life situation, relationships, and practical problems, altered thinking, altered emotions, including mood or feelings, altered physical feelings and symptoms, and altered behavior or activity levels. The 5 areas assessment model enables detailed examination of the links between each area for specific occasions on which the patient has felt more anxious or depressed. So, the strengths of the model. Well, essentially, there's 2 main reasons for working with the patient to identify problems in each of the 5 areas. First of all, it's extremely helpful for us as practitioners. This model facilitates our understanding of the impact that depression and anxiety can have on the patient's subjective experience by highlighting clear target areas for intervention. Essentially, any changes made to any specific area of the model does inevitably lead to changes in other areas as well. Additionally, compared to the traditional CBT model, where the delivery method consists of 12 to 16 weekly 1-hour sessions, this mode of assessment can be easily applied in care environments in a more timely and efficient manner. Furthermore, the traditional CBT model required a lot of adaptation because even with good reading ability, it was insufficient to enable a patient or practitioner to even make sense of the classical technical terminology and concepts. And it actually required practitioners to gain specialized knowledge in order to perform it. Secondly, this model is extremely helpful for our patients. So the 5 areas assessment can be easily understood by patients, and it actually helps them to develop an understanding of the effect that depression and anxiety has on their specific circumstance. The process of writing down their symptoms is helpful in its own and can enable patients to look at these issues more objectively. It can also provide a degree of emotional distance from their experience. Ultimately, this model helps patients to consider their experience of depression or anxiety as a set of interrelated problems that affect various areas of their lives, which provides important insight for treatment options. Despite intended benefits for patients struggling with depression, anxiety, and BDD, this model requires a collaborative assessment that does rely heavily on the involvement of the patient and their willpower. It also focuses on the patient's ability to change themselves. Therefore, patient resistance may demonstrate as a barrier to effective application of this model in patient care settings. The 5 areas model involves diving deep into the root cause of the anxiety or depressive episode. For this reason, it may actually temporarily worsen these symptoms initially before seeing any improvement. Lastly, this model is typically used for assessment of current problems and specific issues. Therefore, this model may assist in breaking the negative thinking pattern, but does not always address the underlying cause of the issue. Model applications. So I figured that to make sense of this model, it would be relevant to relate it back to my practice setting. So oftentimes I have clients that come in for non-surgical treatments seeking to enhance part of their facial features or fix a quote unquote problem. It's not uncommon for a client to come to me with a specific life situation, relationship, practical problem, including the following statement. So, everyone on social media is getting lip filler to make them more attractive. The altered thinking pattern would be, if I don't get lip filler, then everyone will think that I am unattractive. This sort of thinking pattern can alter emotions, leading to low self-esteem and feelings of self-consciousness and insecurity. Sometimes we do see a physical alteration, which can include altered sleep or difficulty falling asleep. For example, if a client's staying up all night researching cosmetic procedures, this can ultimately lead to a reduced sex drive due to low self-esteem. The altered behavior in this situation in relation to the model would be seeking cosmetic treatments, abusing procedures as part of the chase to perfection, or only posting pictures using filters. So why is this model relevant to my practice area and topic? Well, essentially, body dysmorphic disorder is a mental health condition characterized by disproportional occupation with imagined or minimal defects in appearance. This obsession is associated with shame, anxiety, depression, and even poor quality of life. The research states that many individuals with BDD will seek cosmetic treatments in an attempt at resolving their imperfections. The issue is that temporary cosmetic solutions does not often result in satisfaction, and therefore there is this ongoing chase for perfection and essentially low satisfaction and ongoing issues. There is a need to better understand this condition and identify and utilize more common and effective screening measures, especially in cosmetic clinics. The 5 areas model offers knowledge on how to better understand individuals with BDD who may be experiencing acute episodes of depression and anxiety. Additionally, this model provides insight that may assist in the development and application of appropriate and effective screening methods to help better identify individuals who may be struggling with BDD. Thank you very much for listening to the presentation, and I look forward to any further discussions on the topic. Thank you.